In this video presented by Overpsyched, we are going to review Histrionic Personality Disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. First, we will discuss the diagnostic criteria, then explore some of the common features. We will then compare histrionic personality disorder to narcissistic personality disorder, then discuss the prevalence, development, and course, and conclude with our current understanding regarding treatment. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, defines histrionic personality disorder with the following diagnostic criteria: a pervasive pattern of excessive emotionality and attention seeking beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. 1. Is uncomfortable in situations in which he or she is not the center of attention. 2. Interaction with others is often characterized by inappropriate sexually seductive or provocative behavior. 3. Displays rapidly shifting and shallow expression of emotions. 4. Consistently uses physical appearance to draw attention to self. 5. Has a style of speech that is excessively impressionistic and lacking in detail. 6. Shows self-dramatization, theatricality, and exaggerated expression of emotion. 7. Is suggestible, that is easily influenced by others or circumstances. 8. Considers relationships to be more intimate than they actually are. So now that we have the definition of histrionic personality disorder, let's review some of the common features. These individuals are attention-seeking, and others may describe them as lively, dramatic, enthusiastic, or flirtatious. These individuals are uncomfortable or feel unappreciated when they are not the center of attention. If they are not the center of attention, they may do something dramatic, such as make up stories or create a scene to draw the focus back to themselves. They are often inappropriately sexually provocative or seductive. This occurs in a wide variety of social, occupational, and professional relationships, not just with people who the individual has a sexual or romantic interest with. Individuals with histrionic personality disorder frequently use physical appearance to draw attention to themselves. They may spend excessive amount of time, energy, and money on clothes and grooming. They are also easily offended by a critical comment about how they look. They may state strong opinions with dramatic flair, but they tend to lack supporting facts, evidence, details, and their reasons are vague. And these individuals tend to have a high degree of suggestibility. Their opinions or feelings are easily influenced by others. They may be overly trusting, and they may be easily bored. They may have frequent job or relationship changes as a result. And their craving for novelty and excitement may put them in risky or dangerous situations. They tend to consider relationships more serious than they actually are. Individuals with histrionic personality disorder are often manipulative, and they may have difficulty maintaining relationships due to acting out a role, often subconsciously, such as being the victim. And lastly, these individuals tend to have a low tolerance for situations that involve delayed gratification. A mnemonic to help remember some of these common features is the following: praise me. P stands for provocative or seductive. R is for relationships are thought to be more serious or intimate than they are. A is for attention seeking. I is for influenced easily. S is for speech is extravagant, wants to impress or lacks detail. E is for emotional lability. M is for makeup and a focus on physical appearance. And E is for exaggerated emotions. And now that we have described some of the common features of histrionic personality disorder, let's compare it to narcissistic personality disorder. Histrionic and narcissistic personality disorders share some common features, such as attention-seeking or being dramatic, erratic or unpredictable behavior, manipulative, and self-centered or egotistical. Though both personality disorders are often viewed as seeking attention, the primary difference comes from considering their motivation for the attention. In narcissistic personality disorder, individuals are seeking attention as a means to elevate their status or power above others. This is typically not seen in histrionic personality disorder. Also, a feature of narcissistic personality disorder is the failure to show empathy. They more often have feelings of entitlement. In histrionic personality disorder, individuals tend to have excessive emotionality and theatrical style. They have more shallow or volatile emotions compared to narcissistic personality disorder. So both of these personality disorders are listed under Cluster B, and they share many common features. But identifying these differences may help you differentiate between the two diagnoses. So now let's move on to cover the prevalence, development, and course of histrionic personality disorder. Like other mental disorders, including personality disorders, the exact cause of histrionic personality disorder is unknown. The prevalence is estimated to be below 2%, and it is more prevalent in females than males. The risk of completed suicide is not well known. However, individuals with histrionic personality disorder may engage in suicidal gestures, threats, or activities in order to get attention. Individuals with histrionic personality disorder may also have some of the following comorbidities: somatic symptom disorder, conversion disorder, major depressive disorder, and other personality disorders including borderline, narcissistic, antisocial, and dependent. Next, let's transition to discuss some of the subtypes. Now, these are not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. First is appeasing histrionic. This includes dependent and compulsive features. These individuals seek to placate or fix troubles and are compromising. Next is vivacious histrionic. These individuals are seductive, charming, animated, impulsive, and have some narcissistic features. Then there is tempestuous histrionic, and these individuals are out of control, moody, impulsive, or turbulent. Then there is disingenuous histrionic, which includes some antisocial features, scheming, plotting, deceitful, or insincere behavior. Next is theatrical histrionic, mannered, put on, striking postures, or dramatic. And finally, there is infantile histrionic, which includes some borderline features. These individuals have emotional lability, they're demanding, excessively attached, or clinging. And now that we have reviewed what histrionic personality disorder is, let's discuss what we know about treating it. Individuals with histrionic personality disorder tend to not pursue treatment for it unless there are symptoms of depression or if there were troubles in a romantic relationship. As is with most personality disorders, medications provide little benefit unless there is concurrent conditions such as depression. The mainstay for treatment of histrionic personality disorder is typically psychotherapy, including CBT. Functional analytic psychotherapy may also be helpful. In this type of psychotherapy, interpersonal problems are identified, and this differs from traditional psychotherapy in the way that the therapist directly addresses the patterns of behavior as they occur in the session. The in-session behaviors are thought to be a reflection of the poor interpersonal communication and neurotic defenses that occur in other life settings. The therapist provides real-time feedback on the client's behavior and how it may be affecting other areas of their life. And with that, this concludes our discussion on histrionic personality disorder. Thank you for watching, and be sure to check out overpsyched.com for more resources.